Okay, so today we are going to study about the heart failure, right? In the heart failure, first of all, we have drawn the diagram. In this diagram, we have shown that this is a systemic circulation provided by the left heart, and this is called pulmonary circulation provided by the right heart. And we have drawn the different structures like GIT, liver, and kidney, and our nervous system, and our lungs. So these are some of the organs which are directly affected by heart failure. Now today we have only studied the different causes of the heart failure. We have only studied the different causes of the heart failure. And in these causes we have explained, first of all, the intrinsic causes. First of all, we have explained intrinsic causes. Intrinsic causes means that the problem is inside the heart. The problem is inside the heart, not outside the heart. In the intrinsic causes, first of all, we have explained MI or myocardial infarction. In the MI or the myocardial infarction, what really happened? That the heart muscle die. Simply, we can say that the heart muscle die. That condition is called myocardial infarction. Then we have studied the aortic regurgitation. Aortic regurgitation is that when the aortic valve is supposed to close, but it doesn't close very well, and it returns back. So for example, this is supposed to close, but eventually it goes back, does not close properly. That condition is called aortic regurgitation. Then in the same way, there is mitral valve regurgitation, means mitral valve doesn't close very fully. That's called mitral valve regurgitation. Then we have aortic stenosis. Aortic stenosis means narrowing. For example, this is normal aortic valve when it opens, but when the aortic valve becomes very narrow, that condition is called stenosis. That condition is called stenosis, aortic stenosis. In the same way, we also studied mitral valve stenosis. Then we studied severe tachycardia. Means that when the heart has very, very high heart rate, that when the heart is breathing very, very fastly, right? Heart is very, very fast, and when the heart contracts very fastly, right, it does not have the time for relaxation. When the heart does not have a time for the relaxation, the blood from the atrium cannot come to the heart, and it cannot fill the heart. So the heart is unable to push enough blood to the tissues. So that condition can also call it heart failure, tachycardia. And another we studied bradycardia. Bradycardia. Bradycardia is a condition when the heart rate is very, very slow. When the heart rate is very, very slow. When the heart is moving very, very slowly, it cannot push enough blood which is demanded by the tissues. Then we studied hypertrophic obstructive cardiomyopathy. In the hypertrophic obstructive cardiomyopathy, what really happens?
Cardiac muscles.
Yes, there is a hypertrophy of the cardiac muscle on the septal side. Right? This is septal side. So when there is hypertrophy of the cardiac muscle, this problem occurs when the heart muscle contract. When the heart muscle contract, right, this hypertrophy muscle come in the middle, and they cannot allow the blood to go into the aorta. And when the blood in the aorta cannot go very fully, so it can lead to the heart failure. This condition is called hypertrophic obstructive cardiomyopathy. Hypertrophic obstructive cardiomyopathy. So these were the few of the causes where the problem is inside the heart. These few causes where the problem is inside the heart. Then we studied extrinsic causes, and we studied the extrinsic causes. Number one and the most important is hypertension. Hypertension. When the patient has very, very severe uncontrolled hypertension. Very severe uncontrolled hypertension. Then there is severe anemia. That the patient hemoglobin level is very, very low, and the demand of the tissue is normal. But because the heart contraction is also normal, and the demand of the tissue is also normal. But actually inside the red blood cell, hemoglobin is very, very low, and it cannot take the sufficient oxygen to the body tissues. So that can also cause to the heart failure, because in the heart failure we said that heart failure is a condition in which heart cannot meet the body tissue demands of oxygen. Then there is thyrotoxicosis. Thyrotoxicosis means high level of T3 and T4. In the thyrotoxicosis, what really happens that our body tissue demand increase. Our body tissues demand more and more blood and oxygen. So the demand of the body tissues increase, and our heart cannot give this much demand of the oxygen. So it means that the heart fail to give enough oxygen. Then we said the pregnancy, especially if the female has twins baby, if the female carries twins baby and the female is very weak, right, and the female is having anemia or some another problem, weak female having twins babies, so in these female the heart cannot transmit enough oxygen to the body tissue. That can also go to the heart failure. And the last cause we studied, atriovenous fistula. Atriovenous fistula, in which we said that there is abnormal connection. There is an abnormal connection between the arteries and veins. This condition is called atriovenous fistula. And this atriovenous fistula can also lead to the heart failure if this fistula is very big. If this fistula, for example, we give the example of VSD, ventricular septal defect. In the ventricular septal defect, what really happens? That there is a defect between septum and the heart. Blood goes from the left ventricle to the right ventricle initially. So in this condition, the heart cannot meet the enough oxygen demand of the body tissue, and that can also lead to the heart failure. Do you have more questions? Okay, so tomorrow we will study the different signs and symptoms. It means that these causes, when they lead to the heart failure, what really happens after the patient will have the heart failure. It means what are the signs and symptoms and what are the clinical presentation of the heart failure. And tomorrow we'll also study the diagnosis and treatment of the heart failure. So finish our class.